So next we're going to discuss about the median nerve. So first some basic points. So median nerve is formed by the joining of two roots. The lateral root of median nerve joining with the medial root of median nerve, and they join together to form the trunk of the median nerve. Okay, so median nerve is coming from both lateral cord and medial cord. Okay, now what is the root value of the median nerve? Median nerve root value C5, C6, C7, C8, T1. All the roots of the brachial plexus give contribution to the median nerve. Next point, median nerve have both sensory fibers and motor fibers. So median nerve is the mixed nerve, both fibers present, sensory and motor. Median nerve mainly supplies the long flexors of the forearm. Median nerve mainly supply the long flexors of forearm. Now these long flexors are used by the manual laborer to lift the heavy object. Okay, that is why the median nerve is also known as laborer's nerve. Okay, so median nerve mainly supplies the forearm flexors. These forearm flexors are used to lift the heavy objects. Okay, so that is why median nerve is also called laborer's nerve. There are some basic points. Okay, now we're going to see the course of the median nerve. Now course of the median nerve, first in the arm. The relation with the brachial artery will differ in the upper part of the arm and in the lower part of the arm. Now this is medial side, this is lateral side. Okay, now in the upper part of the arm, see the artery and nerve. Artery is medial to the median nerve. See, artery is medial. Artery is medial and the nerve is lateral. Okay, so in the upper part of the arm, brachial artery is medial. Brachial artery is medial to the nerve, medial to median nerve. Okay, fine. In the middle of the arm, the median nerve changing the direction and comes to the medial side of the brachial artery and maintain the same relation. Okay, so in the middle of the arm, median nerve, see it is crossing here. In the middle of the arm, the median nerve is crossing from lateral side to medial side. Okay, so median nerve crossing artery from lateral side to medial side and maintain the same relation. Okay, so in the lower part of the arm and below that cubital fossa, median nerve is the most medial structure. Okay, right. So after the arm, we have cubital fossa. Now cubital fossa is the triangular shaped fossa anterior to the elbow joint, anterior to elbow. Okay, so boundaries. Now this is medial boundary and this is lateral boundary. So medially we have one small muscle, that is our pronator teres muscle. Laterally we have brachioradialis muscle. This muscle, brachioradialis muscle, lateral boundary. Okay, so boundaries, please write. Medially we have the lateral border of pronator teres muscle, lateral border of pronator teres muscle. Okay, and laterally, this is the lateral border of the pronator teres muscle. Okay, and this is the medial border of brachioradialis muscle, and the apex is the meeting point of the two muscles. Okay, what about the base? Base is the imaginary line connecting the two epicondyles. So base is an imaginary line connecting the two epicondyles of the humerus bone. So base is the imaginary line which is connecting the epicondyles of the humerus bone. Okay, right. So cubital fossa boundary is over. A triangular shaped fossa in front of elbow. We know the boundaries. Now, what are the structures? What are the contents of the cubital fossa? I told you, median nerve in the lower part of the arm and in the cubital fossa medial to the brachial artery. So the contents are median nerve, brachial artery. Along with that, we have a tendon and one nerve. Again, contents you have to remember in a sequence. In the INCT exam 2022, they gave this question. Arrange the contents of cubital fossa from medial to lateral. Remember the contents in a sequence. Okay? Medial to lateral. Mnemonic is MBBS. The medial most structure in the cubital fossa, median nerve. Yes, median nerve, this one. Okay. Next, brachial artery. Brachial artery. Next, after the brachial artery, now can you see the tendon here? I'll highlight the blue color, this one. Yes, that is the biceps tendon. That is the biceps tendon. Then last one, this is the superficial branch of radial nerve. That is the superficial branch of the radial nerve. So these are all the contents of the cubital fossa from medial to lateral. So middle most structure is the median nerve, then brachial artery, then biceps tendon and superficial branch of radial nerve. These are the contents. Okay. Now biceps tendon is inserted to radial tuberosity. Biceps tendon is attached to radial tuberosity. Okay. Right. And brachial artery at the level of neck of radius. This is the head of the radius. This is the head of the radius. I am marking H here. Now below that, this is the neck of the radius bone. At the level of neck of radius bone, the brachial artery is dividing into two terminal branches. Can you see the diagram? Yes. This is our ulnar artery. This is our radial artery. Okay. So please write at the level of neck of radius. Please write at the level of neck of radius bone, brachial artery divided into two terminal branches, radial artery and ulnar artery. Radial and ulnar artery. Okay, right. So these are the boundaries and the contents. Usually they'll give you image based question. Identify the structures, injury to the marked structure. Likewise, you may get the question. Next. So in the exams, they may mark any of these structures. So question can be identify the marked structure or damage to the marked structure resulting. Likewise, you may get the question. Right. So that's all about the boundaries and the contents of cubital fossa. So any structure can be marked, identify the marked structure, damage to the marked structure results in. Likewise, they can frame the questions. Right. So from the cubital fossa, median nerve enters the forearm. How, sir? By passing between the two heads of pronator teres muscle. That muscle is having humeral head and the ulnar head. So between the two heads of pronator teres muscle, the median nerve is passing and enter the forearm. So please write. Median nerve enters the forearm by passing between the two heads of pronator teres muscle and supply the forearm muscles, forearm flexors. Supply the forearm flexors. Okay, right. So what are the muscles in the front of the forearm? What are the muscles in the front of the forearm? Again, muscles in the front of the forearm divided into two groups, superficial group and the deep group. Okay. So superficial group in the forearm flexors. Okay. What are the muscles present? Number one, pronator teres muscle. Okay. And then flexor carpi radialis. Then palmaris longus muscle. Then flexor carpi ulnaris muscle. Just below that, we have flexor digitorum superficialis. Okay. So pronator teres muscle, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, and below that we have FDS muscle. FDS muscle. So these are the muscles in the superficial layer. Now these muscles, they take origin from a common point, that is the medial epicondyle. I am writing only ME here. So ME means middle epicondyle. So these muscles, they have a common origin point, a common origin for superficial flexors, a common origin for superficial flexors. Superficial flexors. That is our medial epicondyle. Medial epicondyle. Okay. I told you, lateral epicondyle is a common origin point for superficial extensors of the forearm. Okay, don't forget. So these are the 5 muscles in the superficial flexors. Now see the diagram, the cadaveric image. In the cadaveric image, yes, we are seeing a common origin point for the superficial flexors. The pronator teres muscle, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, FDS, they have a common origin from this side. That is our medial side. This is medial, this is lateral. Because lateral side, we are saying brachioradialis muscle. So the common origin point for the superficial flexors, medial epicondyle. So medial epicondyle is a common origin point. Medial epicondyle is the common origin point for superficial flexors. Superficial flexors of forearm. Okay. Similarly, I told you, lateral epicondyle is a common origin point for superficial extensors. I hope you know that. Right. Next, again, origin insertion, not necessary. You have to know some basic idea only about the nerve supply and the action. Okay. Right. Next, see, no need to know the exact origin insertion point for these muscles. Have some basic idea. That is enough. But you have to know the nerve supply and the action. We see that. Again, the name itself, we have a clue. Pronator teres muscle do pronation. Fine. Flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Now these muscles cross the wrist joint in the front side. What they do? They bend the wrist joint in the front side. They do wrist flexion. So they do wrist flexion. Okay. Now flexor carpi radialis and flexor carpi ulnaris, they deviate the forearm in the corresponding side. So flexor carpi radialis do radial deviation of the wrist. Radial deviation of the wrist. Flexor carpi ulnaris, ulnar deviation of the wrist. Ulnar deviation of the wrist. Okay. Right. So 2 actions for flexor carpi radialis and 2 actions for flexor carpi ulnaris. Palmaris longus, only 1 action. Palmaris longus helping for wrist flexion. Again, the palmaris longus muscle, after reaching the palm, undergo one modification and form palmar aponeurosis. Palmar aponeurosis. Okay. So tendon of palmaris longus muscle enter the palm and undergo one modification and form palmar aponeurosis. Okay. Right. Now FDS muscle. FDS muscle, flexor digitorum superficialis muscle. FDS. I told you already. Digiti, singular form. That means it going to only 1 digit. Digitorum, more than 1 digit. Okay. So now flexor digitorum superficialis and flexor digitorum profundus goes to medial 4 tendons. Okay. That is why we are calling as flexor digitorum. One is superficial, another one is deep. So flexor digitorum superficialis, flexor digitorum profundus. Clear? Right. Now first we discuss about FDS muscle. Now FDS muscle, the tendons of FDS go to medial 4 digits. Okay. Medial 4 digits. Again, it is superficial. It is superficial. Next, insertion. FDS muscle, it is inserted to, it is coming all the way down to middle phalanx. Okay. So inserted to middle phalanx. Okay, so this is very important. Attached to middle phalanx. Okay, now actions of FDS. Now FDS is crossing the wrist joint in the front side. FDS is crossing the metacarpophalangeal joint in the front side and proximal interphalangeal joint in the front side. So FDS muscle action, it flexes the wrist joint, metacarpophalangeal joint and proximal interphalangeal joint. It is flexing all these joints. Okay, and finally attached to middle phalanx. This is about FDS muscle. Okay, so now by this we completed 5 muscles in the superficial layer. If you go deep, we have 3 muscles in the deep layer. One is flexor pollicis longus, flexor digitorum profundus. So these are the 5 muscles in the superficial layer. Next, we have 3 muscles in the deep layer. What are those? Number 1, flexor pollicis longus. Number 2, flexor digitorum profundus. Number 3, pronator quadratus. Pronator quadratus muscle, very simple. It is helping for pronation. Okay. Flexor pollicis longus, flex the thumb. Okay. What about FDP muscle? FDP, flexor digitorum profundus, like FDS muscle. Okay. So next here, we're going to write the points for FDP. Again, FDP muscle is giving tendon to medial 4 digits. Okay. But this muscle is present deep to the superficial muscle. Okay. So it is present in the deep layer. Fine. Insertion. It is inserted to, it is coming all the way down to distal phalanx. FDP muscle come up to distal phalanx. Okay. FDP muscle attached to distal phalanx. Okay. Next, actions. So like FDS muscle, FDP muscle also crossing the wrist joint in the front side, metacarpophalangeal joint in the front side, proximal interphalangeal joint in the front side. Extra one action is there. The FDP muscle also crossing the distal interphalangeal joint in the front side. So the actions of FDP muscle, we're going to write. Number 1, flexion of wrist, flexion of metacarpophalangeal joint, flexion of proximal interphalangeal joint, and flexion of distal interphalangeal joint. The only extra action done by FDP muscle is flexion of distal interphalangeal joint. Okay. Now, in the case of avulsion of FDP tendon, in the case of avulsion of FDP tendon, okay, so patient is not able to flex the distal interphalangeal joint. Patient is not able to flex distal interphalangeal joint. The only movement the patient is not able to do. Okay. So avulsion of FDP tendon, it is seen in one condition, that is the jersey finger. Okay. Right. So now we know the muscles in the flexor compartment of forearm, both superficial and deep layer over. We know the actions of these muscles. Now to this, we're going to add. So nerve supply, I told you median nerve is a main nerve supplying the flexor compartment of the forearm. So now to this, we're going to add the nerve supply. Pronator teres muscle, it is supplied by median nerve. Okay, fine. Flexor carpi radialis supplied by median nerve. Palmaris longus supplied by median nerve. So median nerve supplies pronator teres muscle, flexor carpi radialis, palmaris longus. Okay, what about flexor carpi ulnaris? See, name itself you have a clue. Flexor carpi ulnaris, which nerve will supply? Ulnar nerve will supply. Okay, so you leave that. Ulnar nerve we write later. And what about FDS muscle? FDS muscle, yes, it is supplied by median nerve only. So median nerve directly supplies 4 muscles. What are those? Pronator teres muscle, flexor carpi radialis, palmaris longus, and FDS muscle. So these 4 muscles get the nerve supply directly from the median nerve. Okay, sir. What about the remaining muscles? What about the muscles in the deep layer? Now those muscles are supplied by anterior interosseous nerve. Anterior interosseous nerve. Anterior interosseous nerve, it is a branch of median nerve only. Branch of median nerve. I'll show you here. Right. Now we see the diagram. Now in the diagram, yes. See the anterior interosseous nerve. Anterior interosseous nerve, it is coming from median nerve, branch of median nerve. See this nerve. This one. Right. So anterior interosseous nerve supplies deep muscles. What are those? Number 1, flexor pollicis longus. Number 2, pronator quadratus. Number 3, see FDP muscle, it is also supplied by ulnar nerve. FDP tendon, we're going to divide into 2 halves. So FDP tendon, I told you FDP and FDS goes to medial 4 fingers. Right. Now this FDP tendon, we're going to divide into lateral half and the medial half. Okay. So lateral half of FDP tendon to index finger and the middle finger. Medial half of FDP tendon to little finger and the ring finger. Okay. So we divided the FDP tendon into 2 halves, lateral half and the middle half. So lateral half of FDP means tendon to index finger and middle finger. Medial half of FDP means tendon to little finger and the ring finger. So why we are dividing the FDP into lateral half and middle half, sir? Because they have a separate nerve supply. The lateral half of FDP, it is supplied by anterior interosseous nerve. What about the medial half of FDP? The medial half of FDP is supplied by ulnar nerve. Is that clear? So ulnar nerve also supplies flexor carpi ulnaris. So ulnar nerve in the forearm, so remaining all the muscles supplied directly by our median nerve. Okay. So 2.5 muscle by anterior interosseous nerve, 1.5 muscle by our ulnar nerve, remaining all other muscles supplied by our median nerve. Okay. Right. So these are the muscles in the flexor compartment of the forearm. Right. Next, from the forearm, median nerve entering the palm. Now, it is entering the palm by passing below the transverse carpal ligament or flexor retinaculum. See the median nerve. This is a median nerve. So, median nerve is passing in the carpal tunnel below the ligament and entering the palm. Okay. So, please write median nerve enters the palm by passing below the transverse carpal ligament. Transverse carpal ligament. That is flexor retinaculum. Okay. Fine. After entering the palm, in the palm, the median nerve gives motor branch, which is also known as recurrent branch. So, in the palm, median nerve gives recurrent branch. Recurrent branch or motor branch. Supplies some muscles. We see that. After giving the recurrent branch, median nerve terminally divided into medial and lateral palmar digital branches. Finally, terminally divide into medial and lateral palmar digital branch. Palmar digital branch. Okay. Now this is the course of median nerve in the palm. You see the diagram. Okay. So median nerve, it is entering the palm by passing below the flexor retinaculum. Okay. Now the median nerve in the palm. Now in the palm, can you see this branch? That is the recurrent branch, also known as motor branch of median nerve. See the diagram? So we know the course. Now this is the median nerve. It is entering the palm by passing below the flexor retinaculum. Now in the palm, the median nerve is giving recurrent branch or motor branch. After giving the recurrent branch or motor branch, the median nerve is dividing terminally into this is medial and this is lateral palmar digital branch. Okay, right. Now, I told you recurrent branch is also known as motor branch. Now, what are the muscles supplied by the recurrent branch of the median nerve? The recurrent branch of median nerve supplies thenar eminence muscle. Thenar eminence muscle. So, muscles of palm supplied by median nerve. Muscles of palm supplied by median nerve, thenar eminence muscle. Thenar eminence muscle. Now, what are the muscles in the thenar eminence? We have three muscles. Number 1, abductor pollicis brevis. Number 2, flexor pollicis brevis. If you remove these two muscles, in the deep layer, we have opponens pollicis muscle. So we have three muscles in the thenar eminence. Now these three muscles are supplied by the recurrent branch of median nerve. Very important. So whenever they want to ask anything about the median nerve, the first clue they will give thenar eminence atrophy is present for this patient. So thenar eminence atrophy means, yes, the patient is having which nerve injury? Median nerve injury. So recurrent branch also supplies lateral two lumbricals. The lateral two lumbricals. Lumbricals we have 4. The lateral two lumbricals supplied by the median nerve, recurrent branch. Okay. So in the palm, yes, the median nerve supplies 4 muscles. The mnemonic is LOAF. LOAF. What is L? L is lumbricals. Lumbricals 1 and 2. Lateral two lumbricals. Okay. O, opponens pollicis muscle. Opponens pollicis muscle. A, abductor pollicis brevis. F, flexor pollicis brevis. Okay. So mnemonic is LOAF. So these 4 muscles supplied by the median nerve in the palm. Remaining all other muscles in the palm supplied by ulnar nerve. Only 4 muscles supplied by median nerve in the palm. Okay. So now we know the muscles supplied by the recurrent branch. I told you median nerve terminally divided into lateral and medial palmar digital branch. Lateral and medial palmar digital branch. Palmar digital branch. Now the lateral and medial palmar digital branch, they are sensory branch. Okay, they supply, yes, the lateral 3.5 digits. Lateral 3.5 digits in the palmar side. So lateral 3.5 digits in the palmar side, the sensory fibers are carried by, yes, median nerve, palmar digital branch. Fine. This palmar digital branch also carries the fibers from distal phalanx and middle phalanx, from the lateral 3.5 digits dorsal side. I told you. The superficial branch of radial nerve supplies the lateral 3.5 digits in the dorsum up to proximal interphalangeal joint. The middle phalanx and distal phalanx of lateral 3.5 digits in the dorsum is not supplied by radial nerve. That is supplied by palmar digital branch of median nerve. See? Yes. This is the palmar side. Lateral 3.5 supplied by median nerve, palmar digital branch of median nerve. And in the dorsum, it is supplied by radial nerve. 2019 NEET exam, they gave this question. They gave image-based question. They marked this area and they asked the sensory supply of the marked area. Okay, right. Next. So we know about recurrent branch. We know about palmar digital branch. One more branch is there. That is the palmar branch of median nerve. Palmar branch of median nerve. See the nerve, the diagram. It is passing above the retinaculum band. What about the median nerve trunk? The trunk of the median nerve is passing below the retinaculum. Very good. So please write palmar branch of median nerve which pass above the flexor retinaculum. Okay. And which supplies the sensory supply to thenar eminence. Sensory supply to the thenar eminence. Okay. Right. So thenar eminence sensory supply by the palmar branch of median nerve, and that nerve is passing above the retinaculum. Okay, right. So these are the various branches and the course of the median nerve. Next, we're going to discuss some deformities. So we know the course and the branches of the median nerve. Fine. Now we're going to see some applied. So two deformities you see in the case of median nerve injury. Now first one, Benedictine hand deformity. Okay. So in the Benedictine hand deformity, the patient is not able to flex the interphalangeal joint of the index finger and middle finger. Patient is not able to flex the interphalangeal joint of index finger and the middle finger. The FDP tendon to the index finger and middle finger, the lateral half of FDP supplied by anteriointerosseous nerve. So in the case of median nerve injury, yes, anteriointerosseous nerve injury, the patient is not able to flex the interphalangeal joint of the index finger and middle finger. So patient hand will be like this, and this hand is called Benedictine hand deformity. This deformity is called Benedictine hand deformity. Okay, right. Now one more deformity you see in the median nerve injury, ape thumb deformity. So ape thumb deformity, yes, the thumb will be by the side of the hand. So this is due to the involvement of which muscle? Palsy of which muscle? Opponens pollicis muscle. Due to the involvement of palsy of opponens pollicis muscle. Opponens pollicis muscle. Okay, right. So after this, we're going to discuss two cases. Case number 1, wrist slash injury. Case number 2, carpal tunnel syndrome. Carpal tunnel syndrome. Right. Now, wrist slash injury. Injury of median nerve at the level of wrist. Injury of median nerve at the level of wrist due to suicidal cuts. Due to suicidal cuts. Now, what about the carpal tunnel syndrome? Carpal tunnel syndrome is due to the compression of median nerve while passing below the flexor retinaculum. Compression of median nerve while passing below the flexor retinaculum. Okay, so injury is here. So I am shading with black color. So median nerve is compressed below this ligament. Okay, right. Next. Now, all the forearm flexors supplied by median nerve and the anteriointerosseous nerve, they are normal. Why? They get the nerve supply proximally. So all the forearm flexors which are supplied by median nerve and anteriointerosseous nerve will be normal. Same for the carpal tunnel syndrome. Okay, right. Next, what about the loaf muscle? Loaf muscle palsy. Loaf muscles palsy. Again, same. Loaf muscle palsy. Now, because of loaf muscle involvement, yes, so patient have thenar eminence atrophy. Thenar eminence atrophy. Even the carpal tunnel syndrome also, you see thenar eminence atrophy. Same, loaf muscle palsy, thenar eminence atrophy, and also patient have ape thumb deformity. Ape thumb deformity. Okay, right. Same points for the carpal tunnel syndrome. Fine. Next, loss of sensation. Where, sir? In the lateral 3.5 digits. In the palmar side. Common for carpal tunnel syndrome. Even the carpal tunnel syndrome, you see loss of sensation in the lateral 3.5 digits in the palmar side. Okay. Next, what about the sensory supply of the thenar eminence? The loss of sensation. Loss of sensation over the thenar eminence. But in the carpal tunnel syndrome, the sensory supply of the thenar eminence is intact. Thenar eminence sensory supply, thenar eminence sensory supply is intact. Thenar eminence sensory supply is intact. Why? Which nerve carry the fiber from the thenar eminence? Sensory fiber. The palmar branch of median nerve. The palmar branch of median nerve carry the sensory fiber from the thenar eminence, and that branch is passing above the retinaculum band. Where is the compression? Below the retinaculum band. So the only difference between the carpal tunnel syndrome and the wrist loss injury is the thenar eminence sensory supply is intact in the carpal tunnel syndrome. Thenar eminence sensory supply lost in the wrist loss injury. Okay, other features are same. So now we're going to see the animation for the median nerve. Right. Now see the muscle, that is our pronator teres muscle, having two heads, humeral head and the ulnar head. Now between the two heads you are having a gap. In that gap only median nerve will pass through, will enter the forearm. What is the action of pronator teres muscle? Pronation movement. See the video? Movement of radius over stationary ulna. Right. Now next muscle, we are in the forearm, we are seeing the flexor carpi radialis muscle. We remove that. Next muscle, palmaris longus muscle, that is forming palmar aponeurosis in the palm. Right. We have removed that. Now next we are seeing the flexor carpi ulnaris muscle. We are retaining that. We not remove that. Flexor carpi ulnaris. Now next muscle, that is our flexor digitorum superficialis muscle. It goes to medial four fingers. Okay, now we are removing that. Right. So now we are seeing the deep muscles here. That is flexor digitorum profundus muscle, and that is our median nerve. Okay, that is our median nerve. Now we're going to remove this muscle, brachioradialis muscle, so that you can have a clear picture about the flexor pollicis longus muscle. See there? That is our, flexor pollicis longus muscle, flexor digitorum profundus muscle, and we're also seeing one more muscle in the lower part, that is our pronator quadratus muscle. Okay? There's a pronator quadratus muscle you are seeing there. Right. Now we're going to see the further course of our median nerve. Now see the median nerve, how it is entering the palm. See here, this is a band. That band is our flexor retinaculum band. Now the median nerve, which is passing below this band and then enters the palm. Now can you see one branch there? Now one branch is passing above the retinaculum band. There is a palmar branch of median nerve passing above the band and supply the thenar eminence, carry sensory supply to thenar eminence. Right. Now the median nerve passing below the retinaculum band enters the palm, which in turn gives the sensory supply to the lateral 3.5 digits. These are the palmar digital branches. Now one more branch you have to see, and that branch is the motor branch or recurrent branch. See there? Yes. That is the recurrent branch, highlighted in pink color now. It's a recurrent branch or motor branch that gives motor supply to the thenar eminence muscle and also to the lumbricals 1 and 2. We know the mnemonic LOAF muscle. These are the animations you have to know about the median nerve. So that's all about the median nerve, course, branch and apply.